make sure you get all of them first. Hello, my name is Gabrielle Holenstein, and I'm here to inform you of the field of cancer diagnostics and laboratory procedures like immunohistochemistry, fluorescence in situ hybridization, or FISH, and cytogenetics. About 1 in 8 U.S. women will develop invasive breast cancer over her lifetime. I received an associate's degree in bioscience from Gwinnett Technical College. I also worked at Cytometry Specialists Incorporated, or CSI, for 2 years. CSI is a cancer diagnostics laboratory in Alpharetta, Georgia that utilizes cytogenetics, IHC, or histology, and FISH procedures. Cytogenetics analyzes chromosomes for structural abnormalities. FISH uses radioactively labeled probes to detect the ratio of chromosome centromeres, most commonly used for breast cancer. IHC uses antibodies to bind to antigens that may or may not be present in a patient's sample. These 3 departments within CSI will help diagnose cancers such as breast cancer, colon cancer, blood cancers like leukemia and lymphoma. The first stage in cytogenetics is obtaining a sample with a viable white blood cell count to isolate metaphase chromosomes. These metaphase chromosomes will then be analyzed and mapped out in a karyotype. Certain chromosomal abnormalities are consistent with certain type of blood cancers like ALL or acute lymphoblastic leukemia. FISH uses these radioactively labeled probes for amplification to detect if Herceptin is needed to treat the breast cancer. Herceptin is an invasive treatment, and doctors don't want to use it if they don't have to. Bone marrow or blood clot specimens are collected for IHC. They are then embedded in a paraffin wax. The paraffin wax is then cut into thin sheets and placed on a microscope slide. The microscope slide is then heat fixed with the sample and then treated with certain antibodies depending on what type of cancer they're trying to detect. This is colon cancer. And hematoxylin and eosin stain, or H&E stain, is performed on the sample to detect benign versus malignant tumor. It will just show like benign or normal tissue versus the malignant tumor. That's a close-up view of the same slide. And inflammatory cells with enlarged nuclei will also be assigned to the doctors that there is tumor present. Okay. With this advanced technology, breast cancer deaths have decreased dramatically since the late 1980s.